Good Friday morning, everybody, and thanks for being with us here on KXAN Live. I'm Will Dupree, and coming to you from the KXAN Live studio. We appreciate you joining us. This week, our KXAN investigative team shared an update in its series called Still Practicing. And these stories are focused on looking into transparency when it comes to medical errors and how much information is shared with patients. This time, investigative reporters Matt Grant and Dalton Huey reached out to more than a dozen members of Congress about whether there's much interest in changing issues we identified in our reporting, and only one person responded. Here is part of Matt's story.
I actually fail to see the problem that you're talking about. Of course, that is a state issue, not a federal issue.
North Texas Republican Congressman Michael Burgess says the decision to disclose medical errors should be left up to the states, and says the National Practitioner Data Bank, a confidential clearinghouse of doctor discipline records, should stay sealed to patients.
Well, I don't know what purpose that would serve.
The data bank was established by Congress in 1986. Under federal law, it's only accessible to hospitals and state medical boards. What Burgess does support: capping how much a jury can award victims of medical malpractice.
Should medical liability be a federal issue? And yeah, I'd like to see a federal limit on non-economic damages like we've done in Texas.
Joining us now is investigative reporter Dalton Huey, who helped out with this latest story. Dalton, thank you for being here. Nice to see you.
Glad to be here.
Yeah, we mentioned there the congressman talking about what laws are in place right now in Texas when it comes to medical malpractice lawsuit transparency. What did your investigation find out about those laws?
So we found that in Texas, medical malpractice lawsuits are not required to be reported by physicians or on their public physician profile with the Texas Medical Board unless the case was found by a jury that the doctor was liable, money was awarded, and that there's no further ability to appeal the case. What this means is that over the last 10 years, 97% of medical malpractice lawsuits never went to a jury. So right off the bat, at most, 3% of cases are only required to be reported on the Texas Medical Board's physician profiles.
And as part of this investigation, you all went even further, looking around the country to see what other states do when it comes to these kind of same laws and the premises of them. And in the story that you all have up on KXAN.com, which I hope that people will go and check out at this point, you broke down what some of those states have on the books at the moment and put out this really nice graphic. So tell us about what we're looking at here and what some of the main takeaways are.
Yeah, so we wanted to and specific to medical malpractice reporting, and so we looked at these 5 states: Florida, North Carolina, Colorado, Massachusetts, California, and found that while each have a variety of different sets of laws, all are more transparent than Texas. Colorado, Massachusetts, for example, actually post all settlements, all arbitration awards, all final judgments, with the caveat and the disclaimer on the website that just having a medical malpractice lawsuit doesn't necessarily mean that a doctor is incompetent, but that patients should have access to this information to be able to make an informed decision about their health care.
When you all were looking at the policies that these states have in place, are those the 2 states that really jumped out as having the most transparent laws than others in the country?
I would have to say so. We didn't review every state across the country, but amongst the ones we did, Colorado and Massachusetts absolutely both have that disclaimer that just make it very clear that patients deserve and have the right to know this information about their doctors.
And you can find this, again, this graphic on our website right now, KXAN.com, breaking down physician profiles in other states and what they offer. Just to kind of step back for a moment, Dalton, can you explain what this series is really looking at? We mentioned there at the top of our conversation, but just kind of remind people what you all have been looking into for several months now.
Yeah, so I mean, the whole Still Practicing series now, I think we're on episodes 12 and 13. It started with looking at disciplinary records against doctors, and this investigation was really related to the transparency of medical malpractice lawsuits and how little Texas patients know about their doctors because of the laws that we have in place.
And you all will continue to report on this, I know. Dalton, is there anything that you would want to add that we didn't get to highlight about some of this new reporting that you have out there?
We have a bunch of information, a bunch of details in our web story and in our on-air stories that aired the last couple of days, and I would just say check those out.
Yeah, and here's the latest one right here that Dalton helped write. The headline reads, "A long time before Congress takes up medical error transparency." We played a portion of Matt Grant's story that aired just last night here on KXAN, but you can check that out in full, as well as the graphic that we discussed just a few moments ago, looking at what other states offer when it comes to that medical malpractice lawsuit transparency. Dalton Huey, thank you again for joining us. We appreciate it.
Thank you.
All right, everybody. We mentioned there that you can find all this reporting available to you at KXAN.com and on the KXAN News mobile app that you can access anytime. So please check that out if you haven't already. We appreciate you all joining us here this morning. Enjoy the rest of your Friday and take care this weekend. We'll see you again.